we operate on the upper limb in supine as well as in lateral position. So here we are looking at the supine position. The arm is held by an assistant, and the drape that we are going to use, the sterile plastic drape, we can use two drapes here. One goes onto the hand trolley, and the second one is cut and the arm is threaded through it so that it covers the tourniquet. We will be using few drapes on the trolley as well as on the body that we'll appreciate in the video, and we have to really make sure that the entire body is covered at the end, including the head end. Elbow surgery, wrist surgery, depending on the area, the isolation can be variable as per your incision. So the assistant is holding the arm. You can actually make the assistant wear a sterile gown so that it, even if it's inadvertently get touched to the trolley or hand, there is no contamination. So first plastic sheet is put onto the hand trolley. A second plastic sheet is taken now, that is made a small cut, and that sheet is now taken up to the tourniquet, making sure you seal that area of the tourniquet. The drapes are used. The first drape goes on to the sterile plastic drape. The second bigger or longer drape comes, but the proximal ends are being circumferentially turned along the edge of the tourniquet and hold secure with the towel clip. Another big drape comes in, but now this is coming from the head end. The distal end of that drape can be turned similarly across the tourniquet lower edge, and it is secured with the clamp. Now the second layer onto the trolley comes, that is covering edges of the axilla and the head area. Another big drape comes. This drape is covering the proximal part of the head, the anesthesia tubes and lines, and almost going on to the opposite limb. What is remaining now is the lower end of the body. So a big sheet is taken covering the entire lower end of the body and up to from toes up to the chest. Now, if you are operating on the forearm and there is no need to look at the wrist or the fingers, then one can use drapes, or you can even use a bandage, mop, and isolate the thumb. Another drape comes, that is for isolating from the anesthesiologist over the two IV stand. This way, one can isolate from wrist, forearm, elbow, and lower end of the humerus. So, for wrist and the hand, only you can isolate different areas and check. Most of the areas remains the same. draping technique remains the same, except for if you're operating onto the hand and the fingers, then the extra drape is taken to cover the middle third of the forearm, covering going up to the tourniquet. So that is something to remember, that our surgical plan and incision is going to dictate which area or extra drapes you are going to use, but make sure you use it as a double drape. Then the hand portion can be rested onto the trolley.